Then coming to the features of the poisoning with the arsenic. Arsenic, when the poisoning occurs within 24 hours, then it is called as the acute poisoning. In case of acute poisoning, different systems will present with the different features. On ingestion, as arsenic is garlic in odor, so the patient will present with the garlic odor. Taste that will be presented by the patients will be sweetish metallic taste, intense thirst, salivation, nausea, vomiting, usually projectile in nature, are the initial presentation. Then the feeling of the constriction in the throat, dysphagia, burning and colicky pain in the esophagus, stomach and bowels, abdominal pain, diarrhea as accompanied by pain, tenesmus and irritation around the anus. The stool will be the diarrhea, watery stool, expelled frequently and involuntarily. Color and odor of the stool will be dark in color, stinking, and sometimes the bloody stool may be there. Later it will becomes colorless, odorless, resembling the rice water diarrhea of the cholera poisoning. It may mimic the bacterial food poisoning cholera. So initial presentation of the gastrointestinal features highly mimic with the cholera poisoning. So the patient suspects or the clinicians suspect it as a case of the gastrointestinal manifestations and start the management accordingly. However, the patient doesn't get benefit by the normal clinical management of the gastroenteritis or the cholera poisoning. The ocular manifestations may be the conjunctivitis, lacrimation. In the respiratory tract, if on inhalation of the arsine gas, irritation of the upper airways. Liver may show fatty degeneration. In the kidney, the pain during micturition, oliguria, uremia, urine contains the albumin, cast and the RBCs. Muscular tenderness may be noted. It has effect on the central nervous system. It produces convulsions, tremor, sensation of the walking of insect on the body, that is formication, giddiness, headache, vertigo and general paralysis, delirium, and sometimes severe cases may present with a coma. Then the cardiovascular system will show the different types of arrhythmias, ST and T wave changes, prolonged QT interval, torsa de pointis, ventricular fibrillation, hypotension, ventricular tachycardia, increased vascular permeability, vasodilatation and acute circulatory collapse. Skin will show loss of hair in case of survival and different types of skin eruptions. Body temperature will show increased, that is hypothermia may be the presentation. So you can summarize the clinical features of acute poisoning with arsenic as shown in the picture. Then we must know the difference between the acute arsenic poisoning and the cholera poisoning, as many times the patient may present with cholera like symptoms and the clinicians shall always keep arsenic in their mind as a suspicion. Then in case of arsenic poisoning, the pain in throat is before the vomiting, that is dysphagia will be earlier irritation of the gastrointestinal tract, whereas in cholera the pain in throat is after the vomiting. Then sequence of vomiting and purging. In arsenic poisoning, vomiting occurs then purging occurs, whereas in cholera poisoning, purging occurs before vomiting. So in cholera, the loose stool tendency is first presentation, thereafter the vomiting comes. Then the vomitus in case of arsenic poisoning will contains the mucus, bile and maybe blood, whereas in cholera poisoning, vomitus will contain the watery without any mucus, bile or the blood. Stools in the arsenic poisoning will be dark colored due to the presence of blood, later rice watery. And in cholera poisoning, it will be from initially it will be rice watery, no blood, passed in continuous involuntary jets. Then tenesmus, that is pain, is present in arsenic poisoning, whereas cholera it is not present. Irritation and pain around anus is present in arsenic poisoning, where it is absent in cholera. Voice is not affected in arsenic poisoning, whereas it is rough and whistling in case of cholera poisoning because it is of infective nature. Then conjunctiva is inflamed in arsenic poisoning, whereas it is not inflamed in cholera. Then lab investigation definitely will show arsenic in arsenic poisoning, while no arsenic in case of cholera. Then a stool microscopy and culture will show the Vibrio cholerae in cholera poisoning, while not so in arsenic. Then circumstantial evidence associated with arsenic poisoning will be very peculiar. There the presence of arsenic in the victim's body or the accused body or the some history type, some circumstantial evidence of the homicide or relatives history may suggest towards the arsenic poisoning, whereas in cholera poisoning, evidence of having taken infected food will be in the history of the patients and the relatives. Then usually single victim are involved in arsenic poisoning, whereas in cholera it is the several victims may be involved. Then motives of the arsenic poisoning is usually suicidal or homicidal, whereas in cholera poisoning it is neither suicidal nor homicidal. In case of arsenic poisoning, there is always motive involved, either it is suicide or homicide, or maybe sometimes it is accidental. However, in cholera poisoning, it is not so, it is usually in infective origin. Then accidental cases may occur with arsenic poisoning, whereas in cholera poisoning are generally accidental. Then arsenic poisoning may occur with accidental cases as well as, however, the cholera poisoning is generally accidental in nature, as all the poisoning are either of manner accidental, homicidal or suicidal. All cases either of infective or non-infective origin. Accidental cases may occur with the arsenic poisoning, whereas cholera poisoning is generally accidental only. Then for better understanding of the features of the arsenic poisoning, we must note the features that were presented in the large case series of the patients from the West Bengal chronically exposed to high level of arsenic, that is around 0.05 to 3.2 milligram per liter in a contaminated drinking water. So the following features were presented by the patients, that is raindrop like skin pigmentation is seen in the 100% of cases, palm and sole keratosis was seen in 65.5% of cases, weakness in 70%, gastrointestinal symptoms in 58%, respiratory system involvement in 57%, nervous system involvement in 50%, abnormal electromyography in 34%, abnormal nerve conduction velocity in 34%, hepatomegaly in 77%, splenomegaly in 31% cases, abnormal liver function that included globulin, alkaline phosphatase, ALT, AST, all shows increment in around 30 to 40% cases. Portal hypertension was increased in 33% of the cases. 45 of these patients had liver cirrhosis, which revealed non-cirrhotic portal hypertension in 92% of cases, cirrhosis in 4% of cases, and normal histology in 4% of cases. So, in the West Bengal, at least 8 lakhs person residing in 312 villages are known to consume arsenic contaminated groundwater, and more than 1,75,000 person had arsenical skin lesions. Conjunctivitis, depigmented lesions, melanosis, hyperkeratosis, and keratosis are the most common presentation, but malignant neoplasm and gangrenous lesion have also been found. Cancers of the skin, lungs, and urinary tract are particularly associated with arsenic exposure. Pulmonary regions are also fairly common. You can see here in the picture, this is the picture of the raindrop pigmentation seen in the arsenic poisoning. This is the presentation of the palmar hyperkeratosis seen in the arsenic poisoning. Then the fatal dose for the arsenic trioxide is about 200 to 300 milligram. Pentavalent form of arsenic is less toxic than the trivalent form because it is less soluble in water. Then arsine gas is toxic in 25 to 30 ppm and it is the most toxic form of the arsenic. It is fatal within 30 minutes. Fatal period is usually 1 to 2 days. To make the diagnosis of the arsenic poisoning, urine level shall be measured. If 24 hours urine excretion of the arsenic exceeds 100 micrograms, then regardless of urine volume, it is indicative of toxicity of the arsenic. Urine should be collected in metal-free polyethylene containers. Ingestion of seafood can interfere with the interpretation since considerable concentrations of organic arsenicals such as arsenobutane and the arsenocholines may be present in the shellfish. cod, haddock, and other sea fishes. Although it is not associated with toxic effect, in such cases the analysis must be repeated after 2 days of no fish diet, or if facilities exist, then a specimen of arsenic can be accomplished in high performance liquid chromatography, that is HPLC, and followed by inductively coupled plasma mass spectrophotometry. Then it will be give the exact concentration of the arsenic. HPLC via ion pair chromatography coupled with hydride generation atomic fluorescence spectrophotometry, or by hydride generation coupled with cold trap gas chromatography and atomic absorption spectrophotometry are the best instrument to diagnose the level of arsenic. And basically these techniques can differentiate the various forms of the arsenic. Then after the urine level, blood levels shall be checked. Then the blood level shall be seen. Blood level of arsenic less than 5 microgram per 100 ml is generally considered in the normal range. Then the blood level shall be looked. Safe blood, whole blood, not the serum, for arsenic concentration determination. Interpretation required the specialized knowledge. This is less reliable than the urine level because of short life of arsenic in the blood. However, a blood level of arsenic less than 5 microgram per 100 ml is generally considered in the normal range. Hair level shall be checked in case of suspected arsenic toxicity, in which the urinary arsenic measurements fall below accepted toxic level. Analysis of hairs and nails may yield the diagnosis. Arsenic can be detected in the proximal portion of hairs within 30 hours of the ingestion. Inorganic arsenic can be detected in the proximal portion of hair within 30 hours of the ingestion. I already discussed while discussing the diagnosis of the poisoner. There the segmental analysis of the hair. There I told you that by examining the segmentally the hair, we can detect the exact concentration of the arsenic in different days, and that will indicate of the chronic poisoning with the arsenic and the concentration taken on the particular day. Then in the nails and the hairs, inorganic arsenic is the form best absorbed by these tissues and the form most commonly found in the human poisoning cases. A small amount of methylated metabolites may also be detected. One of the best analytical method for detection of the arsenic in biological samples is atomic absorption spectroscopy. Radiographically also, as arsenic is radio-opaque, abdominal X-ray may reveal its presence in the gastrointestinal tract in acute poisoning. Additional investigation that may be supportive for the diagnosis of arsenic poisoning are the monitor the complete blood count, serum electrolytes, urine analysis for proteinuria, hematuria or pyuria, liver and renal function tests shall be done, obtain an ECG and ensure the continuous cardiac monitoring in symptomatic patients, obtain a chest radiograph in patients with severe poisoning or pulmonary effects. Initial and periodic biological monitoring and medical surveillance are required for employees exposed to the arsenic. Then apart from that, for the employees that are working in the arsenic prone industries, initial and periodical biological monitoring and medical surveillance are required in those employees. This is all for today. We will be continuing in the next class with remaining part of the arsenic. Thank you.